Allopurinol, also known as Zyloprim, is a medication used to treat gout and certain types of kidney stones. It is also used to prevent increased uric acid levels in patients receiving cancer chemotherapy. These patients can have increased uric acid levels due to release of uric acid from the dying cancer cells. Allopurinol works by reducing the amount of uric acid made by the body, which can help prevent gout and kidney problems. It is usually taken once a day, and the optimal time to take it is in the evening with a full glass of water. Always follow your doctor's instructions for the best results. When taking Zyloprim, follow your doctor's instructions and take it once daily after a meal to reduce stomach upset. If your dose is more than 300 mg a day, your doctor may instruct you to take smaller doses throughout the day. It's important to drink a full glass of water with each dose and at least 8 more glasses of fluid a day, unless your doctor advises otherwise for medical reasons. Your doctor may also provide instructions on how to decrease acid in your urine. The dosage of Zyloprim is based on your medical condition and how you respond to the treatment. It's important to take this medication regularly at the same time each day to get the most benefit from it. For the treatment of gout, it may take several weeks for Zyloprim to have an effect. You may experience more gout attacks for several months after starting this medication as your body removes extra uric acid. Remember that Zyloprim is not a pain reliever, so continue taking your prescribed medicines for gout attacks as directed by your doctor. If your condition lasts or gets worse, be sure to inform your doctor. If you experience stomach upset, nausea, diarrhea, or drowsiness, be sure to let your doctor or pharmacist know. Remember, your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience numbness or tingling in your arms or legs, easy bruising or bleeding, unusual tiredness, signs of kidney problems, signs of liver disease, unusual weight loss, eye pain, or vision changes. In rare cases, allopurinol may cause very serious skin reactions, especially in certain ethnic groups. Your doctor may order a blood test to measure your risk before starting this medication. If you develop any symptoms of a serious skin reaction, such as skin rash, blisters, itching, or swelling, seek medical help immediately. A serious allergic reaction to this drug is rare, but if you experience symptoms such as fever, swollen lymph nodes, rash, itching, swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for more information. Before taking Zyloprim, make sure to inform your doctor if you have any allergies or have had a severe reaction to it in the past. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor, especially if you have liver disease, kidney disease, diabetes, high blood pressure, or are following unusual diets such as fasting. Zyloprim may cause drowsiness, and consuming alcohol or marijuana can intensify this effect. It's best to avoid driving or operating machinery until you know how this medication affects you. Alcohol may also reduce the effectiveness of Zyloprim, so it's advisable to limit alcoholic beverages. If you use marijuana, talk to your doctor about it. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Zyloprim should only be used when clearly needed. It's essential to discuss the risks and benefits with your doctor. Additionally, this medication can pass into breast milk and may have undesirable effects on a nursing infant, so consult your doctor before breastfeeding. When taking Zyloprim, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zyloprim include blood thinners such as warfarin, capecitabine, and didanosine. Be sure to discuss any potential interactions with your healthcare provider before taking Zyloprim. If you suspect an overdose with Zyloprim, seek immediate medical attention. If you are in the United States, you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center. Remember not to share your medication with others. Your doctor may conduct lab and/or medical tests to monitor your uric acid blood levels, liver/kidney function, and complete blood count while you are taking Zyloprim. It's important to keep all your medical and lab appointments. If you are taking Zyloprim to treat kidney stones, you may benefit from a special diet. Be sure to consult your doctor for more details. If you forget to take a dose of Zyloprim, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to store Zyloprim at room temperature, away from light and moisture. Keep it in a safe place, away from children and pets. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember to always follow the proper disposal guidelines for medications. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.